Warfarin. What is warfarin? It is an anticoagulant drug. Well, coming to the point, mechanism of action. In the liver, number 2, number 9, number 7, number 10, these factors, and including the protein C and S, they are supposed to be synthesized or activated in the liver. And for their activation, they need a cofactor known as vitamin K. So what happens when vitamin K combines with them? They will become activated. First of all, this vitamin K cofactor will be reduced by the NADPH into reduced vitamin K, and in the meanwhile an electron will be released, which will be used for the modification of these factors. And then what will happen? This reduced, after the reduction, the vitamin K epoxide will be formed, and this vitamin K epoxide, then vitamin K epoxide reductase enzyme, this enzyme will then convert this vitamin K epoxide into vitamin K. Now this vitamin K is available again to do its job as a cofactor and to help these factors to change them or to do their activation. So coming to the point here, that how will it do the modification of these factors? The point is that they will do the carboxylation. We have the glutamic acid residues on these factors. This vitamin K will help in doing the carboxylation on these residues. Means it will help adding the carboxyl group to the glutamic acid residues, especially on the GABA position. GABA carboxyl glutamic acid. Now this is responsible to activate these factors. Now what will happen? Factor number 2, number 7, number 9, number 10, they will be activated, and protein C and S, they will also be activated. So now what is their job? Let's see their job. Factor number 10, number 9, number 7, number 2, as I mentioned here, they are actually called as procoagulants. When they are activated, they will do the coagulation, the very first thing. So when they are activated, they will do the coagulation. And coming to the next, that is the proteins, protein C and S, they are responsible to do the anticoagulation because they are anticoagulating proteins. Now a question rises here, that coagulating and anticoagulating both will combine? Yeah, both will combine, and both will show the actions. How like? Here we have 4 factors. In case of the number 2, number 7, number 9, means procoagulants are 4 and anticoagulants are just 2. That is the protein C and S. They will inhibit the factor number 5, number 8. Factor number 5 and factor number 8 both are present here. Factor number 8 factor is just in the intrinsic pathway before the 9. Well, number 8, number 9, when they are inhibited, you know, these factors, all the factors are responsible to do the coagulation or blood clotting. So when they are inhibited, they will not do the coagulation or not the blood clotting. By means of inhibition, in the pharmacology, we mean that we are reducing the activity. Mostly we mean that we are reducing the activity of certain receptors, certain enzymes, certain proteins, certain factors. So here, when C and S, these proteins are activated, they will just inhibit these 2 factors, factor number 5 and factor number 8. After their inhibition, what will happen? When they are inhibited, the clotting mechanism will be reduced. So the question again rises here is that, then how the clotting happens? The answer is that we have 4 factors of the procoagulants and just the anticoagulants are 2. So you can guess from their numbers. Now 4 factors have enough strength as compared to 2 factors. So then due to which what will happen? The clotting will happen or the coagulation will happen. Now coming to the point, anticoagulating effect of the warfarin. When we indicate the warfarin to the patient, it actually blocks the vitamin K epoxide reductase enzyme. After its inhibition, what will happen? The vitamin K epoxide will not be converted to vitamin K. And what will happen next? Vitamin K is not available as a cofactor to activate these 2 factors. So then what happens next? When the procoagulants, I mean that when factor number 2, number 7, number 9, number 10, when these factors are not activated, they were supposed to do the coagulation. Now what will happen? Anticoagulating effect will increase. Means the blood coagulation will not happen. It is decreased. Like this, warfarin is doing its job as like an anticoagulant. And the next thing, that is the protein C and S. So when there is no cofactor, these will also not be activated. Their job was to inhibit number 5 and number 8. So now when these two factors are not inhibited, what will happen? Before, when they were inhibiting this, they were stopping the coagulation. Now they are not inhibiting factor number 5 and number 8. So when these are not inhibited, what happens? These factors are responsible to do the coagulation. So like this, when we give the warfarin, they will do the anticoagulating effect by means of not activating these factors, and there will be a kind of coagulation observed due to these factors. Why? Because these two factors, I mean these two proteins or factors, both are the same terms. C and S proteins, when they are not activated, they will not inhibit the factor number 5 and number 8. So they will actually increase the coagulation or clotting. And this is the very point that when we give or when we indicate the warfarin to the patients, warfarin will show its action, that is anti-coagulating effect, within a couple of days then. So that's a little bit from my side about the warfarin mechanism of actions. Hope so you got. If still you have any kind of question regarding the topic, you can drop that in the comment box. We'll come for the answers very soon. Thank you for watching.